two Canadian provinces hardest hit by COVID-19 are dealing with some grim new figures. Quebec's overall case count has surpassed 100,000, first province to do so. Ontario is reporting a daily total of more than 1,000 infections for the first time. A second wave sweeping central Canada as well. We're waiting for health officials to release the latest figures today. How much do the daily totals accurately portray how the virus is spreading? That's one of the things we're going to look at now with Dr. Christopher Labos, who's with us usually on Mondays. This week, no exception, an epidemiologist and cardiologist from Montreal. Morning, Dr. Labos.
Good morning.
Why don't we begin with the province where you are this morning, Quebec, as I was just mentioning, reaching a milestone that many Canadians would have thought unthinkable, 100,000 cases. I'd like you to speak to that overall, but also help us understand, Dr. Labos, why health officials sound optimistic. They think that things are going to get better as the restriction period comes to an end in Quebec.
Yeah, so obviously 100,000 cases is a milestone nobody wanted to reach. But if you look at the situation a month ago and what was happening compared to what's happening now, things are actually quite a bit better. Remember that over the course of September, you had this rapid doubling of cases. You went from 100 to 200 to 400 to 800 cases in a very short span of time. So you had this uncontrolled exponential growth of the virus. And then once the lockdown measures were instituted at the beginning of October, what you've seen throughout this entire month is, first of all, that exponential growth has stopped. Things have largely stabilized, and the case count has started to come down a little bit. So it does look like things are going better. Now, obviously, we would have preferred if the cases had dropped much more precipitously, but at the very least, we've halted the potentially disastrous uncontrolled growth of the virus and managed to put things in a slightly better situation where we can at least handle stuff and where the number of people in hospital and in an ICU is at least manageable to a certain degree.
Ontario will certainly be looking to see what's happening to the east because Ontario's exponential growth has not really slowed. As I mentioned, more than 1,000 cases yesterday for one-day totals. That's a record number. So again, can you help us understand the context behind this? Is it more testing? That's probably part of it. Is it Thanksgiving gatherings? What exactly is going on in Ontario as you see it?
I mean, it's probably all the things that you mentioned. The other thing to remember is that because there was such a backlog of cases in Ontario, as that backlog gets processed, you're going to see numbers go up, but they're going to reflect infections that happened, potentially weeks ago, not necessarily infections that are happening today. So you have to be a little bit careful about over-interpreting the daily numbers and really look at the average and the general trend. Even Ontario, things look relatively stable. I think, as a lot of people are, there's some concern that maybe after the Thanksgiving weekend, we're going to have a bit of a bump in cases as people may be gathered against the advice of public health institutions. So we'll have to see. At the very least, though, things are staying relatively stable in Ontario as well, where you had the rapid increase in cases, where cases went from 200, 400, 800. At least they haven't gone to 1,600, so they haven't doubled yet again. So as long as things remain relatively stable and we can contain the virus, there's every reason to believe that with a little bit of extra effort, we can start to have the cases go down again and get through this current cold and flu season.
So extra effort on Canadians, on citizens' parts, or there's a lot of pressure on the Doug Ford government to perhaps in those areas where the numbers are really spiking to bring in further restrictions and lockdown measures. And some communities are urging him to resist. There's a little bit of a push and pull there. Do you think it's appropriate in some of the regions to tighten things up more?
I think it may ultimately become necessary. Remember, we have quite a few months ahead of us with the winter coming where the virus is going to spread much more easily. So it may very well become necessary. Now, that being said, even if the government doesn't impose certain restrictions, people can still be careful. You don't need the government to tell you to do something before you can do it. People can themselves decide to stay home and limit their contacts and limit unnecessary physical interactions. So as long as everybody does that, whether it's mandated by government or not, the number of cases will go down and there will be a decrease in the number of new infections.
Doug Ford just announced 1 o'clock this afternoon for his latest briefing. We'll hear what kinds of advice he has for Ontarians at that time. I have a question, Dr. Labos, about something that we heard over the weekend. It was a bit of a jaw-dropper for many people. It was Donald Trump's chief of staff, Mark Meadows, on one of the Sunday shows yesterday morning, making rather a stunning admission about the administration's approach to handling COVID-19. Let's listen to this a little bit together, and then we'll talk about it.
Here's what we have to do. We're not going to control the pandemic. We are going to control the fact that we get vaccines, therapeutics, and other mitigation
Why aren't we going to get control of the pandemic?
Because it is a contagious virus, just like the flu.
Yeah, but why not make it?
We're not, I'm just going to cite that back, we're not going to control the pandemic. And that prompted immediate responses from critics. Dr. Labos, New York's Governor Andrew Cuomo, for example, calling it the Great American Surrender. If they just let it go and don't try to get control of this, what does it mean to us who sit right atop this country?
I mean, yeah, it was a bit of an odd statement to make. I mean, on the one hand, I think I sort of understand the point that he was trying to make, that there are some factors that are outside of your control and some factors that are. But it is sort of reminiscent of a lot of the philosophy that administration has had, which is that we're not going to do anything about this virus. We're not going to enforce social distancing. We're not going to enforce mask use. Yes, I mean, in one sense, you can't control a virus, but you can control how quickly it spreads. If people keep their distance, wear masks, and avoid large gatherings, I think we've demonstrated that we can significantly decrease the number of new cases. So while you may not be able to, quote unquote, control a virus, you can minimize it. And I think it's a little worrisome that you have people in authority that are essentially giving up, because frankly, you don't have to give up. Anything that we do now is going to have an impact, and maybe you can't do anything about the people who have already gotten sick, but you can do quite a lot for the people who are going to get sick. And if there's one thing that we can predict going forward, is that if we do nothing, a very large number of people are going to get sick.
The border closure has been extended to November the 21st. Does that remain an important thing, a consideration for you in light of the fact of what we're hearing out of Washington and the States?
I mean, I think so. I know a lot of people enjoy going down to Florida over the winter, but I mean, when you look at the situation in the U.S., the number of cases there, it really doesn't look like it would be safe either for Canadians to go to the U.S. or for Americans to come to Canada. Tourism is probably something we're going to have to live without for a little bit, at least, because the situation really doesn't look like it's under control in any way that we could tolerate, movement across the border at this point.
Although there's a lot of reporting right now in this country about how many Canadians are going regardless. They are snowbirds. They want to get to the south, and they're going regardless of those figures. 80,000 a day, 1,000 deaths a day. Those are the numbers we're getting out of the States right now. So it is a concern and one to watch. And Dr. Labos, I thank you for watching it with us this morning.
Thank you.